Section 1, Introduction. Publication on the My Aged Care website. From February 2024, the Department will begin publishing aged care providers' finance and operations information on the My Aged Care website through the existing Find a Provider tool. The additional information will be available for residential care and home care providers. Increasing transparency helps older people, their families, and carers make informed decisions about their care. This video provides a brief overview of the additional information that will be published for home care providers. There is also a video about the additional information that will be published for residential care providers. This is available on the Department's website. The financial and operational information being published on the My Aged Care website includes food preparation, income and expenses, surplus or deficit position, hourly wage rates for registered nurses, enrolled nurses, and home care workers. Some of this information will be updated quarterly, and some of the information will be updated annually. The new information also includes activities to support a diverse and inclusive environment, diversity of the provider's governing body, compliance information from the provider's board, and service provision and use. And this information will be updated annually. To access this new information, go to the My Aged Care website in your internet browser at www.myagedcare.gov.au. Click on the Find a Provider tool. Select Search for a Provider from the drop-down menu. Select Find a Provider by name and click Next. Select the type of provider you're looking for. Select this from the drop-down menu. Then type in an aged care provider's name. Then click Search. Section 2, Home Care Information, Publication on the My Aged Care website. The new information is listed in the tabs running underneath the purple banner. For home care providers, additional data has been included in the Overview tab, the Compliance tab, and the Finances and Operations tab. I will show you the new information in each of these tabs. I'll also flag that the following screenshots are mock examples only. The data is all made up. First, let's go to the Overview tab. I will demonstrate what's new in the Overview tab. This includes new additional information about specialised care. While specialised care information is not new in My Aged Care, we have included new information in this section about diversity and inclusion. This information can be found by clicking on Show Details. You will see the new information about what the provider does to make people from all backgrounds feel welcome. This information shows whether the home care provider has policies and procedures for culture, diversity and inclusion, social activities to support culture, diversity and inclusion, and policies and procedures for cultural safety. The information also includes whether the home care provider has or has not implemented these initiatives or is in the process of doing so. The next tab we will look at is the Compliance tab. This is an existing tab with new information. The Compliance tab for each home care service on My Aged Care will include compliance information from the provider's board. The information will be published to show whether the provider's governing body reported that the provider has or has not complied with all of its legislative responsibilities and requirements during the last financial year. Where the governing body reports a non-compliance, specific information will be included about the type of non-compliance. For example, the aged care quality standards in this example. Whether the non-compliance issue was resolved within the reporting period, the reasons for the non-compliance, and the actions taken to resolve the non-compliance. For home care providers, in the Compliance tab, there is new information about the most common kinds of compliments and concerns raised with the home care provider, as well as key improvements the provider has made. The Finances and Operations tab is a new tab that has been added. This is where most of the financial information will be presented, along with additional business details published about the home care provider. The Finances and Operations tab includes information about the provider's expenses, income, surplus or deficit. The expenditure information for each provider shows how much the provider spent on care and services in the financial year. For home care providers, the breakdown of expenses and income are shown slightly differently to residential providers. Home care providers will show a percentage of the home care provider's total expenses or income. In contrast, residential care information on the myAgeCare website will compare the facility to the sector average. Clicking on the arrows to the right of each category of spending expands each item to see which items are included in each category. By clicking on the arrow next to care expenses, you can see a breakdown of spending within this expense category. Continue to scroll down the Finances and Operations page for more information on provider finances, including income sources and surplus or deficit information. After expenditure information on the Finances and Operations page, information will be provided about where the provider gets its income from. A pie chart will show how income is split between care income and management service fees, noting that these are different to the income categories presented for residential care, and from other income, which relates to income from investments. You can click on the arrows to the right of each income category for more information about what's included in each of these income categories. Still in the Finances and Operations tab is information about how much the provider's budget was in surplus or deficit in the last financial year. This information shows whether a home care service made a surplus or deficit during the last financial year. Surplus, if it's a positive figure, or deficit, if it's a negative figure, are used here rather than profit or loss. This is also shown alongside the percentage of the home care provider's total income. When choosing a care provider, it's important to know that the staff are fairly paid. This table shows how staff at this organisation are paid and how it compares to the sector average rate. This information can be found in the Finances and Operations tab for home care providers. Wages information includes the role type, enrolled nurses, home care workers, and registered nurses against the sector average, and the wage rate variations for each role for the provider. The Finances and Operations tab will also include a pop-up page that will contain additional information about the business. This will include information about key personnel and types of diversity included on the provider's governing body. Additional business details will also include information about the service usage. That is, the number receiving home care packages, new people who received a home care package, and the number of people who ceased receiving a home care package during the last financial year period. Section 3. Support. Publication on the myAgeCare website. For more detailed information, please refer to the Publishing of Finance and Operations Information webpage available on our website at www.health.gov.au. This includes training resources, including frequently asked questions, webinar recordings, and videos. For technical difficulties, contact the myAgeCare service provider and assessor helpline, the toll-free number on 1800 836 799, and select option 5. For all other inquiries, please email the Provider Operations Data mailbox at provideroperationsdata@health.gov.au.